Good afternoon, ladies and gentlemen. I am Dr. Shubhada. I'm an occupational therapist and an ergonomic consultant with Godrej Interio. So I'm sure occupational therapy as a profession is rarely or most probably never heard of. So I will quickly give you an example of what it is about. We will soon break for lunch. I'm sure you guys are looking forward. How many of us drink soup using a fork? No one? Correct. Because as simple as that, eating is an occupation and using a spoon to drink soup is ergonomics. As simple as that, ergonomics and occupational therapy explained. So like physiotherapy, occupational therapy is also an allied healthcare profession. We also use therapeutic exercises to make the most out of the person, to treat the person's physical, mental, psychosocial needs and make sure that person is performing their occupation up to the mark and productivity is attained. So I would like to now bring your focus on what the pandemic did to us. There was a drastic, sudden and forceful shift from physical workspace to digital workspace. Irrespective of your age, irrespective of your profession, every functional transaction was online. There was no option. So what did we all do? We sat on the floor, we sat on the dinner table, every corner of the house was our workspace. We did whatever it took, but we kept going. Gradually, as the time went by, we did furthermore adjustments. We got a better table to sit on the floor with. We got a higher table to sit upright on a chair because no one can sit on floor all the time. So what are these small adjustments and adaptations that you did during pandemic? All of it is ergonomics. Okay? Just having a fancy chair in your office space, ergonomic chair is not ergonomics. There is more to ergonomics. As humans, we are innately built to make these adaptations constantly to make ourselves comfortable within the environment that we are surviving in and we have to be productive in. So what about these spaces? This brings me to the evolving learning and education spaces, which with respect to the topic of today, these have to be adaptable. Between the transition between the physical and the digital, constant transition between physical and digital spaces, we have to be adaptable. It has to be inviting, it has to be smart, it has to be comfortable and definitely safer for everyone sharing and interacting in that space. So ergonomics is not restricted to these things. Adults and children both sharing the space are equally affected by how you place your spaces, how you create your spaces and how they are used by both students and teachers. How many of you can relate to this? Upper back, neck pain, lower back pain, wrist pain, knee pain. How many of you can relate? Please raise your hand. Any of it, no, or all of it? All of it, all of the above, right? So, if the space that you are in, the children and the staff and the teachers who are using that education space, who are not, have been provided with the adequate training and knowledge, this is the long-term effect of that. A non-ergonomic space, a dimension environment may lead to bad posture habits. Okay, so the growth process of students is affected. The teachers are affected with health hazards, which can be chronic and long-term. And administrative staff like CEOs, trustees, other heads are also exposed to this hazard. So both adult students in education space with prolonged sitting, standing, and using of the touchpad instead of a mouse, all these little things can accumulate to long-term health hazards. Okay, so functional utility in learning space is a key step towards enhancing the learning environment. It is important. And unfortunately, education space doesn't emphasize on ergonomics. Everyone is like, ye to office wala kaam hai. Kyun? Even we sit. Even we need to sit. Even we need to prolong, and teachers have to prolong, have long-standing experience in their profession. They have to go to different floors for the classrooms. So there is a lot of physical fatigue that brings in. So they develop a bad habit or posture habit which has to be rectified, for which they have to be trained. So ergonomics is important that way. As we move on, Godrej Interio offers a human-centric environment via the ergonomic consultancy, wherein we provide audits of the ergonomic spaces, we assess it, then we suggest the required corrections, and what we briefly did, those stretches, is part of the prevention training program, where we retrain you and develop good posture habits. And even if you take a movement break for 2 minutes, like you just get up and move from your chair for 2 minutes after sitting for long hours and take a mindful break, you will benefit from that. These are little things which help you in the long run. So, for example, as part of wellness at work, we offer this training wherein, for example, we did these muscular stretches for upper back. Let's relate to eyes, like a shutter of a camera. You remember the flickering of the screen that you see when you try to take a picture of the laptop? Imagine your eye and brain constantly adjusting so you would see it smoothly rather than it going faster. So your eyes are constantly adjusting, your pupils are constricting and dilating according to the need of the hour. So your eyes are constantly strained after long screen time. So I'll quickly demonstrate an exercise for same. Please be seated, you did not get up. All of you close your eyes. And on my instruction, open them and without moving your neck, try to look at the ceiling. Without moving your chin. The neck and chin remains at the same level. Look at the ceiling, look at me, look at the floor. Slowly move to the right, center, left, center. Now we'll go in a rotation manner. Up, right, down, left, center. Again, up, left, down, right, center. So, did you feel any movement at the back of your eyeball? Yes? What you did was stretching of your ocular muscles of the eye, which help you move your eyeballs. Even this stretching will help you to refocus and also help you from preventing getting a strain because of long use of screens. Okay? Similarly, let me now quickly demonstrate a relaxation. You need not always move when you are on a break. You can also relax. For this, I need a mindful, conscious presence. So all of you close your eyes and just listen to my instructions. Take your conscious mind on the name of on the body parts that I'll be naming. Okay? Take your attention to your feet and toes. Imagine your feet and toes. Picture your feet and toes. Now consciously take efforts to relax them. Slowly take the attention to the calf muscles. Consciously relax your calf muscles. Take the attention to your knee. Relax your knee. Keep your eyes closed throughout. Now take your attention to your chest. Relax your chest. Take your attention to the upper back and neck. Focus on the neck. How does it feel? Relax it. Take your attention to your jaw. Unclench it. Relax it. Now, slowly rub your palms together and place it on your eyes. Feel the warmth that the palms have generated. How did that make you feel? So, this technique that I used was conscious differential relaxation. So, you consciously pay attention at that part of the body and mindfully relax it. So, even in a 2-minute break, even if you do this at a focused body part which you think it's at stress, is uncomfortable, this little technique, even for a minute, will help you recover and rejuvenate. Simple, nothing tough at all, and it doesn't even require a lot of time to be invested. Similarly, we can quickly do a breathing exercise. Keep your eyes closed. Now, relax your shoulders, relax your elbows. Sit comfortably with your back rested. Just breathe in and breathe out comfortably. No forceful, nothing extra, just normal breathing. Now what we do is focus on the air that is entering and the air that is going out of the nose. Focus for 3 such breaths. Focus on the air entering the nose. Focus on the air exiting. Do it one more time. Slowly open your eyes. How did that make you feel? Even though it's just breathing, we do it every day, every time, unconsciously. But once you focus it, it helps you to relax as well. Okay, so these are certain exercises and relaxation techniques that are used for as a part of the training we provide at these audits, workspace audits. So I would like to conclude with the fact saying that raising awareness about such importance of ergonomics. Raising awareness of the importance of ergonomics in education spaces. It is not limited to office spaces. Okay, it has to be, the awareness has to be created in education spaces like schools, colleges, universities, even private coaching classes. Everyone from smaller kids to older kids, even the staff involved, be it administrative staff, be it educational staff, whoever it is. So the presence of ergonomics in educational spaces is very crucial right now. And the more we quickly act upon it, the better for everyone who is interacting and using that space. So a correctly designed education space and everything has crucial impact on all of our health. So I request you all to make sure that you do pay heed towards this, and if you have any queries, please meet me at the Interio kiosk. Thank you so much. You were a lovely audience.